Welcome to our interview series from the Community of Practice for Global Health R&D, an initiative that's hosted at the Global Health Center within the Geneva Graduate Institute, and which is co-convened in partnership with Uniting Efforts for Innovation, Access, and Delivery. The rationale behind this series is to spotlight unique initiatives that are active in global health R&D and that seek not only to develop new therapeutics and treatments for diseases that are, let's say, often neglected by the mainstream profit-driven pharmaceutical actors, but that also work towards expanding access to their products. My name is Julia Slovensky. I am a project coordinator of the Community of Practice for Global Health R&D, and I am delighted to introduce today's discussions with experts from Clodomiro Picado Institute, which is attached to the Faculty of Microbiology at the University of Costa Rica. And indeed, it's a unique institution at the forefront of antivenom research and development and production. It was inaugurated in 1970, and the institute was created to address a public health need initially, but since then, it really broadened its scope, expanding well beyond a national purpose. We see today the institute contributing to addressing snakebite and envenoming not only in Costa Rica, but also abroad, and forging partnerships with a multitude of actors, public and private actors across the world. To better understand the specificities of the Clodomiro Picado Institute, we have the pleasure to be joined today by two experts from the Institute, which I would like to introduce and then give the floor to individually to say a bit more about their work at the Institute. So first, we will start with Professor Jose Maria Gutierrez, Professor Emeritus at the Clodomiro Picado Institute. Welcome.
Thank you very much, Julia, and greetings to everybody. Yes, my name is Jose Maria Gutierrez, and I am Emeritus Professor of the School of Microbiology and Instituto Clodomiro Picado of the University of Costa Rica. I have worked in the Institute for 50 years this year, and I basically, my work has focused on research on snake venoms and snake bite envenoming, also on development of antivenoms and in public health activities related to the prevention and management of snake bite envenoming. As being part of the University of Costa Rica, I also teach in the university, and I am involved in extension programs.
Thank you so much. 50 years, that's quite an experience. I know we've talked about this before as well. We're so happy to have you here and share all of this rich expertise with us. Moving on, I'd like to introduce Dr. Maria Angela Vargas, a researcher at the Technological Development Section, Industrial Division of the Institute and the Faculty of Microbiology. Maria Angela, you have the floor.
Hello. Well, thanks a lot for inviting us to this interesting podcast. I am really glad to share with you and also with Jose Maria. Jose Maria is one of my mentors, so I am really happy to share this space with you also. I have been working at the ICP for 15 years. I belong, as you say, to the Technological and Development section. This is our R&D section in the Industrial Division at the ICP, and also I am professor of the Microbiology faculty. We are actually a team of 4 researchers at the Technological Development Department with interdisciplinary background, and we also collaborate with the other sections of the Industrial Division and the Academic Division.
Okay, thank you so much, Maria Angela. Again, thank you both for joining. So just to say that because the Community of Practice of Global Health R&D, we have a lot of institutions, a lot of actors that are active not only in the field that you're in, but also in other neglected diseases, rare diseases, and other therapeutic areas. And I think that your model is really quite interesting, being embedded within the public institution as an academic actor, but also branching out in the way that you have done. It's a unique experience that really deserves to be shared, and many people I think would love to learn more about how you've managed to do that. So let's just start a bit with the institutional framework and the business model. What we call it business model, the alternative model that you're adopting. Could you briefly talk a little bit about the institute's founding, the institutional structure, how it works, how it combines this academic research and industrial production, so both legs, within a public institution to sustain its mission?
Well, Instituto Clodomiro Picado was founded in 1970, but actually is the outcome of many national efforts carried out in Costa Rica related to facing the problem of snakebite envenoming. So in the decade of 1960, the government, the Ministry of Health, decided that it was important that Costa Rica harness all the knowledge and tradition in this field and develop for the first time its own antivenom production. So a very unique program known as a antivenom program started. It was coordinated by the Ministry of Health with the involvement of the University of Costa Rica and the Embassy of the United States of America, which was supporting the program. Through this interinstitutional and international effort, in 1967, they were able to produce the first batches of antivenom in Costa Rica. So owing to the success of these first efforts, the government promoted, the Ministry of Health promoted the creation of an institute to continue with this antivenom production. So Instituto Clodomiro Picado started in 1970. But since the University of Costa Rica was playing such an important role in this initiative, in 1972, there was an agreement between the Ministry of Health and the University of Costa Rica, and Instituto Clodomiro Picado then became a unit of the University of Costa Rica in 1972. This was very important because being part of the university, the institute devoted its efforts not only to the manufacture of antivenoms, but also to generating a very active research and scientific and technological research program, and also to teaching activities in the university, and also to extension programs. So I like to say that the Instituto Clodomiro Picado is like a table with four legs. One is antivenom production, one is research, one is extension programs, and one is university teaching. And this integration of these activities has been very important in creating a holistic approach to the problem of snakebite envenoming, not only just to provide the treatment, which is an important part of our duties, but also to generate knowledge and to disseminate this knowledge in our society and in other countries as well.
Okay, thank you so much. This is really fascinating to learn about how the institute came to be and how it developed in time. And I think that the four-leg analogy is also very important to learn from. I'm wondering if you can maybe detail a little bit more how currently, so historically, this has developed from the 70s to the present moment. Currently, how do you think, or how do you feel that the institute is managing to integrate the industrial division with the public element and academic element in a more R&D oriented practical way? So I think there are two entities, or two different type of entities, that are traditionally thought of as being separate. People think, research originates in academic institutions and then is being brought over and taken over by a private actor, an industrial actor, but you're managing to do both of them. And I'm just wondering, what are maybe the challenges in doing so, or the particularities that you'd like to share about it?
Yes, well, along the history, along these 5 decades or more than 5 decades of the Instituto Clodomiro Picado, we have been very careful in keeping a balance between the generation of knowledge through basic and applied research on one side, and also to the application of this knowledge in the development, improvement, and production of antivenoms, and also in the dissemination of knowledge to society. So we have been very careful at keeping this balance. And in the organization, in the organigram of the Institute, we have two main divisions: the research division or academic division, which focuses mainly on teaching and basic research activities, and the industrial division, which focuses on technological development and production of antivenoms and other products. So we have been careful to keep this balance and not to give a prioritization to one of these branches. And by keeping this balance, we have managed to promote very strong links or bonds between the basic knowledge, the generation of knowledge, and how this knowledge can be applied to the improvement of antivenom manufacture and treatment. So this balance between production, economic profitability, depending on production and distribution of antivenoms, academic efforts to generate knowledge, and then within a social perspective of well-being for the society, in the sense that all of our efforts are at the end directed towards saving lives of people bitten by snakes. So I think it's the balance between and the integration between these different activities that has allowed the institute to provide and has allowed the results that the institute have been able to accomplish.
I would like to mention two aspects, additional aspects, besides all the ideas expressed by Dr. Jose Maria, is that also in the idea of getting the two divisions, but and the research flow that goes along with it, also our R&D section is also placed inside the industrial division. So it's kind of next door communication with our collaborators that work at the manufacturing process. So sometimes, since we do new products, but also improvement of technologies or the product, we can communicate directly with actually the persons that are manufacturing in the different is part of the manufacturing process. So if there's something about in the horse establishment or in the fractionation facility or something, we can directly contact, because they are the next doors. We just open the door and we communicate with them. We can see, we can feel what they are feeling about their worries, what they need. So this is kind of really easy communication, so that we can address with scientifically a scientifically approach how we can improve that particular issue they are demanding, for example. So this is, I think, a really important factor. And another one that I would like to share is something that we also analyzed before, and also with Jose Maria in another space, is that the one big challenge is, because being a public institution within a university also have kind of a little bit of disadvantage, because in an organizational point of view, the managerial group, we are professors, and not necessarily our background is of an administrative background. So we have to be evolving and managing differently the manufacturing part, and seeing like all these in a perspective that sometimes it's a little bit academic. So we have improved this evolving since 1970s to nowadays, because before there were not that much analysis of production cost or purchasing on maintenance programs or administration of inventories, distribution and marketing. So in this way, we have been evolving and learning, while the history of the institute is also going. So this, I think, it's kind of a bit of challenge of being inside a university.
I'd like to stress another point, which is very important and has to do with the culture of the institute. Since the very beginning, a culture was created based on a very intense cooperation, and on the sense that the work of everybody, regardless of the position at the institute, is very important for the whole for the fulfillment of the objectives of the institute. So this culture of respect for what everyone does, and of a strong coordination and communication has been really important to achieve our goals.
Thank you both. Very interesting to hear. And actually, Jose Maria, I think I wanted to say exactly that it seems that, it's a culture of collaboration that comes from inside, and it's being forged within the institution, which makes it work so well. And then it's being exported, it's being taken outside as well. But it seems like it's founded on a very solid basis. And also, this is not in the script, but it seems Maria Angela, based on your explanation, which was very, very useful to learn more about how the R&D section works. You have many hats that you have to wear. You know, you have an academic hat and you have an industrial hat.
Yeah.
It seems very challenging. So kudos on you for being able to do it, both of you, and to go between the different roles that you have to fulfill. Um, Maybe I wanted to add and ask as a follow-up on this. You mentioned, I think both of you at some point you mentioned the various funding sources that the institute relies on, which span from the basic public sector funding that funds the academic institution, but also mentioned private sources and revenues. And I'm wondering, on the one side, if you can maybe detail a little bit how the institute is funded, but also how this contributes to the maybe the independence, or not the independence, but um, the integration of the institute as a self-standing but embedded institution in the broader university.
Mhm. Well, yes, our funding comes from several sources. The main source of income from our institute comes from the revenues that we get from the distribution and selling of antivenoms in Costa Rica, other regions of Central America and Latin America, and Sub-Saharan Africa. So this is the main source of income. But also, being a public institution, we receive funding from our university, which in turn receive funding from the government. So this is a public university funded basically by the government. So we also receive a piece of our budget from the public funding of the university. Also, in terms of research, we get funding from grants, which we apply in Costa Rica. I must say that the funding for research in Costa Rica is not strong, is weak, but we nevertheless get funding from our university and from other sources of funding in Costa Rica. But also we, through our scientific collaborations with colleagues in many regions of the world, we get funding also from international agencies of funding research. And so these are the three main sources of funding. I would say in the past we had a donation from a foundation in the United States, but that has been the only donation we have received, but it was important at that particular point. So this is pretty much the landscape of our funding.
Okay, thank you so much. And I mean, would you be able to share if some of this funding is earmarked for specific projects, or is it core funding? I mean, in terms of the grants and the donations. Um,
Well, yes, that particular donation was specifically to strengthen our antivenom manufacturing capacity, particularly for improving the outcome of antivenom for Sub-Saharan Africa. And with that donation, we bought some pieces of equipment and some works in the farm where we keep the horses for antivenom production. The grants basically are like typical research grants, which are funded to tackle specific questions of research related to the mechanism of action of venoms, to the improvement of antivenoms, to development of new inhibitors, and so on. So this is the typical funding of grant focus on particular research questions. And then the funding from the revenues of antivenom, this funding comes to our institute and is used to the regular work of our institute in terms of production, research, and so on.
Thank you so much for this follow-up explanation. We've seen that the Instituto Clodomiro Picado collaborates with over 115 entities globally. And I guess the bottom line question is, how do you do it? In what way do you do it? How do you prioritize these partnerships? How do you select the partnerships? How do they function? How do you set priorities for R&D and including expanding beyond antivenoms?
Well, yes. One characteristic of our institute has been the international projection. Since the very beginning, the founders of the institute realized that the institute, although it was designed to tackle the problem of snakebite envenoming in Costa Rica, it should look in a broader perspective. And this philosophy of internationalization and cooperation has been very important since the very beginning. in terms of cooperation, I would say that we have two main lines of cooperation, which are very much integrated. One has to do with the typical cooperation in research. And in this, we have been able to establish cooperation with many, many research groups in every continent. So along the years, through personal contacts, through institutional contacts, through student exchanges, we have managed to build a very strong network of cooperation, both north-south cooperation with countries in the north, in the global north, and south-south cooperation, which has been very important with countries in the south. So this research cooperation has been based on research projects on specific questions related to the characterization of venoms, to the study of the mechanism of action of venoms, the search for new inhibitors of venoms, the clinical trials of antivenoms, and so on. So research questions. And it is interesting that this very strong network of collaboration has not been based on formal agreements, but instead on more and more informal connections between researchers and students. And there is a book called the New Invisible College, which argues that the strongest scientific cooperations are based on this kind of more informal links and bonds between people interested in common areas of research. So we have built our cooperation in research on this particular basis. But also we have developed a very strong cooperation in the area of antivenom development and production. We have cooperation with many laboratories, particularly public laboratories, antivenom manufacturers in Latin America. And in fact, we contributed to the development of a network of public antivenom laboratories, manufacturing laboratories in Latin America, which is now a formal network called RELAPA, the public network of public antivenom manufacturing laboratories in Latin America, which is coordinated by the Pan American Health Organization at this point. So we have also had this strong international cooperation with antivenom manufacturers. And the philosophy behind this cooperation is that the knowledge that we generate should be made available to anybody interested in producing antivenom. So we have had a very open attitude towards sharing our knowledge on antivenom manufacture toward these groups. And now also we have expanded this international collaboration in antivenom development and manufacture to countries in Africa, the Middle East, and Asia as well. So I would say that the international cooperation has been based on these two main areas of cooperation, and has been based on a philosophy that knowledge should be shared for the well-being of people and for the development of solutions to confront this problem of snakebite envenoming.
Great, thank you so much. I think it's fascinating to hear about how the philosophy of collaboration is such a strong feature of the institute. I'd like to maybe ask a follow-up question on the type of collaborators that you're working with. You mentioned that you're fostering both North-South and South-South cooperations, and mentioned the RELAPA network as well within Latin America. And I'm wondering if you can maybe say a little bit more about how these collaborations, how do they work differently, if they do work differently, if they have different characteristics, yes.
Yes, well, yeah, they are different in a way. Having this common basic philosophy of sharing knowledge, in the typical research cooperation is characteristic of any type of research cooperation. So we have collaboration with colleagues. We ask questions of common interest, and we develop research projects. Sometimes with the main focus of the research is in the foreign laboratory. Sometimes it's in our laboratory. This cooperation involves common visits of researchers from our lab to other labs, and from other labs to our lab, exchanges of students. We receive many students from different countries, and from Costa Rica as well, and we send our students to other laboratories. So this is the typical academic cooperation, which flows very well and has been fundamental for our achievements in research. For example, we have been able to access very sophisticated equipment that we don't have in Costa Rica and is present in laboratories, particularly in the global north or in countries like Brazil, for example. So with these exchanges, we have been, for example, we have been able to build a sophisticated proteomics laboratory based on our collaboration with a group in Spain and so on. So this in terms of research. In the other branch of collaboration, the collaboration more related with antivenom development and production, this has worked mainly through contacts with these public laboratories in Costa Rica, in Latin America and abroad. And this research is based on several activities. For example, specific technical questions. So very often we are approached by colleagues from these laboratories asking a specific technical question related to antivenom manufacture to solve a particular problem in their groups. That's one type of collaboration. Another type of collaboration is the development of seminars, workshops, webinars between these groups in Latin America, where we share expertise, we share knowledge, we communicate the issues and needs of the different laboratories. That's another one. Another type of collaboration is receiving visitors from these public manufacturing laboratories to be trained at the institute and to go back to their countries with this knowledge. Also, we have been we have gone also our people to other laboratories to learn from their activities, experience, and facilities. And also another aspect of this collaboration has to do with common research projects, projects related to the improvement of antivenom or to the analysis of whether an antivenom is effective against a particular venom of a particular country. Because our distribution of antivenoms to other countries is always based on a previous knowledge where we demonstrate that our antivenom is indeed effective against the venoms of the snakes from the country where these antivenoms are going to be distributed. So this involves research, particularly by the technological development group of our institute, analyzing whether our antivenom is effective against venoms from different countries. And after those results are obtained, then we decide whether we should distribute this antivenom to these countries. So this is another area where we have collaborations. Also, we have been we have collaborated with in clinical trials. It's interesting because the antivenoms manufactured in Costa Rica have been tested in clinical trials, which is a difficult issue to do. In Colombia, for example, and in Nigeria, and more recently in Eswatini. So this is another aspect of the international collaboration where our antivenoms are tested clinical. So there are many aspects, but basically all of them are based on the realization that we need the collaboration of other people need our collaboration, and working together we can achieve significant goals.
Great, thank you. Yes, I think you're completely right. I think that, international collaborations of this sort should be more common. And maybe in previous conversations, we've discussed a bit about, the characterization of this model and what we, as I was telling you, what we call cosmopolitan public-private partnership, because it involves so many actors that come together from both public and private spheres. And for the Instituto Clodomiro Picado, I think it's a very maybe good application of the model in the way that it distributes and collaborates with actors abroad. So we were talking, I think, about collaborations with private actors in African countries, etc. And I think that on a country per country basis, you're adjusting and adapting the model, collaborating not only with private actors and public actors, but also with regional actors, with international organizations that can support and help. And I was wondering if you can detail a little bit more about the strategy that you're adopting in this way that is adaptive, I think, and responsive to challenges, local challenges.
Yes, well, depending on the nature of the collaboration, then we develop specific mechanisms. For example, in terms of academic collaboration, is basically the traditional relationship between researchers and student exchanges and research projects. In terms of collaboration with public sector, as I mentioned, we collaborate with antivenom manufacturers in different countries, but also we have a close collaboration with ministries of health, not only by distributing antivenoms to the countries, but also for providing training in terms of prevention and treatment of snakebite envenoming. So we often visit hospitals, not only here in Costa Rica, but also in other countries, where we give seminars on the way snakebite envenoming should be prevented and treated with the use of antivenom. So that's another aspect of the international collaboration with the public sector of particularly of Latin American countries. We also participate in webinars, international webinars related to these topics. Now, it's interesting to see the collaboration with the private sector in terms of antivenom distribution, because the way we have managed to distribute antivenoms to many countries in the world has to do with the mechanism that our institute developed years ago to do this, because it's very difficult for a public university to sell the antivenom directly to ministries of health in different countries. We do that in Costa Rica because we sell it directly to the social security system of Costa Rica. But when we want to distribute antivenom to other countries, we were faced with the need to have a partner which will take the distribution of antivenom in that country. And these partners have been private companies that distribute pharmaceutical products. So in each country where we distribute our antivenoms, and these countries involve all Central American countries, Peru, Ecuador, St. Lucia in the Caribbean, sometimes the Guyanas, and several countries in sub-Saharan Africa. In each of these countries, we made an alliance, a partnership with a private company that distributes pharmaceutical products. And these are these private companies, the ones that participate in the public bids where antivenoms are requested from the ministries of health. So they represent our institute, and we establish contracts with these pharmaceutical distributors of pharmaceutical products, contract that establish the rules by which these antivenoms should be distributed and sold in these particular countries. And through this mechanism, which I would name as a public-private partnership between our institute and these companies, we have been able to reach many different locations in the world in terms of antivenom distribution. So I would say that this is the type of partnership. Also, we have been in close contact with the public health international organizations, particularly the World Health Organization and the regional office of the World Health Organization in the Americas, which is the Pan American Health Organization. So we also have close collaboration with these organizations in terms of the development of public policies. We were instrumental in the initiatives that led to the acceptance of snakebite envenoming in the list of neglected tropical diseases, the WHO. And in this goal, we had a very productive alliance with our Ministry of Foreign Relations, our Ministry of Health, and with many international NGOs such as Global Snakebite Initiative, Health Action International, and the representations of many countries. Through this international alliance, we contributed to the positioning of snakebite envenoming in the agenda of the WHO. And now we are also collaborating with the positioning of snakebite envenoming in the agenda of the Pan American Health Organization. So I would say these are several lines of international partnerships that we have established with the private and the public sectors.
Great. Thank you. That's really very impressive. Quite a broad range of partners, again, from all types of organizational forms as well. I'm wondering, in terms of the private actors that you mentioned, and maybe this is a good segue into the next set of questions that we had, which had to do around the strategies of the Institute towards global access, and the ways that you can, to some extent, have a role in that, given that the technology is being transferred. So I'm wondering if you can talk a little bit more about the strategies for ensuring accessibility in other countries, especially through the lens of your work through partners such as private actors.
Mm-hmm. Okay. One way to project the role of our institute internationally is to improve our antivenom manufacturing capacity. And for this, as Maria Angela explained, we have a strong technology development group, which constantly improves the technology for antivenom production and develops new antivenoms. So one way to expand this international partnership of our institute is to improve our antivenom manufacturing capacity. That's one thing. The other thing is to to project our knowledge through technology transfer to other laboratories by specific support for improvement of antivenom production, or we have also attempted to do technology transfer of the whole package of antivenom manufacture. An example is a project we are development with Sri Lanka to transfer the technology of antivenom manufacture to that particular country. So in another line, also the work we do in collaboration with the World Health Organization or Pan American Health Organization also contributes to expanding the projection of our institute. But then in the last years, and Maria Angela can tell this in more detail, we have also introduced a new type of relationship with the public sector, and has to do with a technology transfer related to human blood-derived products, a technology that was developed in our institute and has been transferred to a private company in Colombia, but Maria Angela can tell more about this. So we have several ways to expand our activities and to contribute to the access of antivenoms. Needless to say, in agreement with our philosophy, the price by which these antivenoms are being sold is a price which makes them accessible to countries in the global south, and this is another aspect that has contributed to the projection of the institute to other regions. Also, I must add that the knowledge that we introduce through our research in support of our products is a very important element in the accessibility and acceptability of this product, because all the antivenoms that our institute produces are supported by a strong research in terms of the technology of the antivenom manufacturer, in terms of the demonstration of preclinical efficacy of these antivenoms for the venoms of the countries where they are going to be distributed, and also in some cases, like in South America and Africa and in Central America, with the clinical efficacy of antivenoms. So when we present our antivenom for a different country, this antivenom is supported by a body of knowledge that ensures that this antivenom is going to be safe and effective in the country where it is going to be used. And this increases the acceptability and the accessibility of our antivenom in different settings and countries. So this is an example of how the research supports the production and supports the distribution and accessibility of antivenoms in the world, because in many cases, antivenoms are distributed to countries without having the support of a strong preclinical evidence of efficacy and safety. And in this particular aspect, the presence of research and production in the same institute, Clodomiro Picado, contributes to the accessibility and distribution of the antivenom.
Also, to round a little bit that idea, is that actually differently as in other manufacturing sectors or private companies, our main marketing strategy is actually scientific publications. So either we have more a basic of understanding antivenoms or venoms or the physiopathology of envenomation, and all this background. And also when we do applied research, we most likely, not necessarily, but it is a strategy that we also use to also publish our results regarding manufacturing improvements. So one of our main channels of marketing of the ICP products, and also to arise the affordability of our antivenoms, is through scientific publications. And this is kind of interesting because it's not the usual way that, for example, a private company will use.
And also, I must add to this what Maria Angela is saying, that in the countries where we distribute our antivenoms, we usually make efforts to visit those countries and give seminars to physicians and nurses on how to use the antivenoms, how to treat the snakebite envenomings, and so on. So we do these seminars all over Central America, in all the countries in Central America, and more recently in Ecuador and Peru. So, for example, I had the opportunity to visit Ecuador several years ago to give seminars to the social security system of Ecuador, where we were distributing our antivenoms. So I visit several 4 and 5 cities in Ecuador and offer seminars to physicians and nurses treating snake bite. So the distribution of antivenom was also linked to this extension or training activities of physicians. We did the same in Peru last year with a webinar attended by many physicians in Peru because our antivenom was beginning to be distributed in that country. So the combination of the research support that Maria Angela has mentioned with these extension programs in terms of training physicians and nurses on the treatment of snakebite envenoming and the distribution of antivenom itself, it's like an integrated package of intervention that goes well beyond the selling of antivenoms in the country and includes other aspects that contributes to the solution of the problem in those particular countries.
There are two other private stakeholders that I would like to add in our current manufacturing workflow, and one of them is the suppliers. So we get contact with the suppliers of our raw material. Our main gold raw material is plasma, hyperimmune plasma. So we have been having contact with private suppliers of plasma, but usually we are the ones that produce our plasma, but also all the raw materials and all the providers of the equipment supplies and all the different parts of our manufacturing processes, they are really important to get in contact with this acquiring of our raw materials. And usually, for example, when we want to improve technology, we need to get to know new equipment. So we enter with a type of collaboration. This is a public-private collaboration where actually there is personnel of these private companies that come to ICP so that we can go along together with a really applied tests of the technology we want to test. So we have tried, for example, different technologies for a particular point of manufacturing processes, and then we have to decide the relationship between cost and effectivity of the implementing this new strategy. So we at our research section, we have invest a lot of time in searching for the best strategy, technological strategy or equipment. And also you need to guarantee that you always have your raw materials so that you can go along with your manufacturing processes. So we have a set of providers and suppliers of the different points of our manufacturing process, and they are key in all the process, because we have them. Without them, we cannot process. So this is a really important stakeholder also, and the other one is the competitors, the private competitors. We also get, since we are a public institution, we are not necessarily entering in this type of kind of competition in the same way, but they are around. They are like satellites. And along the history of ICP, we have had several private competitors of antivenoms, and they represent a really important also actor in all this ecosystem. They usually sometimes they push us to improve or to do analysis of our production cost or our selling cost, and this also affects our operation, and it's a really important stakeholder to take in account also.
I think you're right that the collaborations with manufacturing partners, but also the, let's say, indirect collaboration with or parallel collaboration with private competitors is also very important. And thank you so much for bringing it up. Thank you so much to both of you for these very useful comments. I think this is already paving the path to the discussion around collaboration with the private sector, regulatory navigation, and already talking about this, the role of knowledge and how knowledge is integrated within the model. And Maria Angela, you mentioned, I think, about the marketing strategy that is centered around the scientific publications, which is indeed not a very common approach that we see that is being taken over by the private sector, and it is a very alternative approach, how we would call it. Maybe, at the same time, the institute is also engaging in selective patenting, and I'm just wondering, in terms of the strategies of using intellectual property, but also keeping an open data sharing approach, how these two strategies either come together, or do you think that they are complementary? If they are, how do you make it so?
Yes, if I may, Maria Angela, let me just do an introduction, and then you continue with the example of this technology transfer. Well, basically, we have decided that in the field of antivenom manufacture, we have to be open, because it's a disease that affects the impoverished communities. It's a disease that is confronted mainly by the public sector. So we have been, in this case, very open to transmit the knowledge we have developed openly. But then in the case of blood-derived products, it's a different story, and Maria Angela will mention that.
So, as Dr. Jose Maria said, we have a strong social responsibility that is always addressing and influencing our decisions. And so the thing is that the new era or the recent era of emerging intellectual property strategies and offices and everything that has to do with this topic emerged at ICP maybe like 15 years ago, and this was really influenced by the new policies at our university that were also influenced by policies, international policies in other universities, both public and private universities, where new units of all the transfer technologies, they are called the OTTs, Office of Transfer and Technology, appeared in the administrative structure of universities. So this started at the same time. This office at UCR and at university is called ProInnova. So they emerge based on all these kind of influential new perspective in the ways that now knowledge can be kind of transferred or sell or something like this. So they started to point out that we have so many useful and so many knowledge that could be sensible of protection. So they were kind of like that influence that they were telling, can you consider this possibility among all the different activities you do? So at that point, we started just like kind of not doing a direct judgment of, no, we don't like this idea. We just started to learn about it by doing. So at that point, we were it is kind of coincidental. We were also in a point where at Costa Rica, a new problem was emerging, but not necessarily in the area of antivenoms, but in the area of blood-derived products. It is not kind of new. Also, Jose Maria told me has told me that in the 70s or 80s, this was kind of also entrepreneurial idea of of some of our colleagues at ICP of getting that since in our mission of the ICP we have the possibility to impact and to solve problems of our society by endogenous scientific knowledge. So at that point, in like 15 years ago, there was like our social security system was in need of two main therapeutic medicines derived from blood plasma, and there were the antibodies, human normal antibodies, and the albumin. So at that time, what we said is that if we have the technological platform for doing antivenoms derived from hyperimmune plasma, maybe we can use our technological platform to fractionate human plasma. So we enter with a discussions and the possibility of making an agreement with the social security system at like a public agreement. And at that point, we were at the technological development department addressing not the political issue, but the technological issue. And we started with the idea of using the technology that all the big pharma of the blood-derived products were using, and actually is the current one they use. But we encountered that it was really difficult to apply this technology to low and middle income countries, because it's quite expensive, because it has to be done at below 0 degrees, all the process. So the investment and equipment and everything was quite challenging. And so we started looking for strategies, and we get to implement a new technology and to develop a new technology for the fractionation of plasma. This technology works both for antivenoms and also for blood-derived medicines, specifically albumin and IgG and antibodies. So this was just like a lot of factors that were happening at the same time. And since we get to this new technology that was easier and cheaper, and that we developed like in a vision that we were imagining ourselves and our manufacturing colleagues doing the technology. So this way we can kind of design it, because we were the final users of the technology. So this way, I think this helped us a lot to make a simpler technology. And that technology has the potential to be protected because it was new. And so at that point, since we were receiving all the influential for this new office to consider the protection of any of our ideas, so we started to look that this was kind of really good idea to be protected. Also because as Jose Maria said, this impacted the possibility to low and middle income countries to address the problem of all the need, the actual, that is a current need of plasma-derived products, but in a really different environment, because this has to do with big pharmas that are the ones that are all the main companies, is like maybe like 6 to 10 big pharma that are they have a monopoly of all the manufacturing of these type of medicines. So this kind of represented an additional kind of pathway for low and middle income countries, so that they can access to a most cost-effective technology. So at that time we started with protection, but we were also learning. We get to courses of how to write patents, and then everything was kind of learning together along with this new office. So the time has passed, And also kind of in a way that it was not necessarily planned, in a moment where we have this technology protected in several countries. Now this office hired a broker, and so that they can sell the technology. And something that is kind of like serendipia, they told us, now we have find someone that wants to license the technology, because this particular a businessman that is really, he's really acknowledged, he's from Spain, in all the ecosystem of transfer and development of new businesses and biotechnology business. He said, now I find someone that wants to license that technology, and it's me. And this is and he was the one that bought us, well, not bought, but because what we did is, it was a transfer agreement. And it was kind of like a really curious history in this part, because the one that we hired for being the broker and find someone to be interested in the technology was the actual one. So something interesting in this story is that he kind of collaborate and form a really strong collaboration with a Colombian partner. So they founded a new company based on Colombia, but it's a Latin American company, to use our technology developed at ICP to do blood derived. So this is kind of technology developed in Latin America for Latin America, so that we can all try to manage the problem of the supply of this type of medicines in our latitudes. So the type of agreement we did is the licensing of the technology, and they are still in the regulatory part of, they have already built two facilities, fractionation facilities, and we are collaborating in navigating and helping them to pass all the regulatory issues based on Colombia, so that they can register the products. And also, this has been like step by step. We did a technology transfer, I think, on 2019. And they also, as Jose Maria said, at that time we get a lot of visits from them, and they came along with us so that we could go hand by hand, showing them how to do that technology. And so we did this in a kind of intuitive process, because we figure out what will you need to perform this technology. We prepared a technology transfer package. It's like a 200 pages manual with all the information we think at that time that was necessary to transfer that technology.
Great. Super interesting story. Thank you so much for sharing and for giving all of this detail and the different type of transfers of technology that you're doing. And I think that it touches so well on my penultimate question. Is not my last question, but is my penultimate question, which has to do taking a little bit from what you said, Maria Angela, and from what you said, Jose Maria. It has to do with the type of licensing agreements that you're having with private actors, but with also with other entities. And I'm wondering, Jose Maria, you mentioned when you were talking about global access, and you were referring to affordability and pricing mechanisms in the technology transfer agreements. I'm wondering how these are embedded in the agreements, how these agreements come to be, and how much role can you play in ensuring access through these agreements. If there are any conditionalities that can be attached to it, if these transfers are handled by you, or also mediated by international organizations. Just a bit more detail about this would be, I think, very helpful.
I would say that we have a sort of an eclectic approach to this question that you are asking, because depends on the type of product and depends on the area of research where we are talking about. then we have different mechanisms. So initially, in the terms of the antivenom manufacture, we developed this strategy of basic on sharing the knowledge that we have developed through publications, through technical exchanges with, particularly with public antivenom manufacturing laboratories, and through training activities to physician nurses in Latin America and elsewhere. So in the area of antivenoms, the strategy has been very clear. It's an open strategy, and we have looked for accessibility in terms of the pricing of the antivenoms, and also in terms of establishing the relationship with private distributors in different countries. So this strategy is well developed, and the future, in my view, is whether we can expand our production of antivenom to supply more antivenoms to countries in the global south, or also to transfer the technology of antivenom manufacture on an open base. But now, dealing with other developments and activities like the human blood-derived products, like Maria Angela was explaining, then the story is different. So in that case, we need to identify which stakeholder would be the one to approach. And in this particular aspect, our university has this technology transfer office. Actually, it's an office related to the management of intellectual property and so on. So actually, we follow the regulations that our university establishes. And in this particular example, in the human-derived products, as Maria Angela explained, it was very clear it was necessary to file a patent. It was necessary to protect this development in different countries, and to start development partnerships with people that could license this technology. So in the future, I would foresee these two different lines of activity developing: an open policy, open knowledge policy in terms of antivenom, and perhaps other areas where we think our knowledge should be open and available to everybody, and other areas whereby we need to protect the knowledge and to establish this technology transfer program. So we need to learn along the way how to handle different technological alternatives, and what would be the best way to project this knowledge to the society in Costa Rica and elsewhere. In the long term, however, our goal is always to benefit humankind, to help countries to solve problems, health problems, particularly problems related with envenomings by animal bites and stings. So being in a public university with a philosophy of public well-being and the use of knowledge for the public well-being, we need to follow this philosophy. At the same time, we need to ensure the economic sustainability of our project by obviously by selling this product and getting revenues for technology transfer and so on. So it's a challenge for us to how to handle all these alternatives in a changing world, in a challenging world, and respecting the values of our university, while at the same time ensuring sustainability of our project.
Great, thank you so much. Very encouraging words. And really a model that I think goes beyond the community of snakebite and venoming. I think it's a model that can be applied in many other therapeutic areas. I guess the last question that I wanted to ask is not related to any of the blocks of questions that we've approached so far, but I just wanted to give you the space and the possibility to add anything that you think is unique, special about your organization and that we haven't talked about yet, but you would like to mention it. I think Jose Maria, in previous conversations, Maria Angela as well, we've talked a bit about the differences and the I don't know, prioritization or the way that old versus new technologies are seen in your field. Yes, anything else that you think would be interesting for people to learn from, please feel free to share our ad.
Yes, well, I have several thoughts in my mind. One is that science, technology, and knowledge should be used for the well-being of people. We know we are in an economic landscape where profitability is important, but I think for particularly in a problem like snakebite and venoming, we should focus on the need to help people facing this very serious problem that affects their lives in many different ways. And in that sense, I like to stress that science, knowledge, technology should be used not in terms of what economic profitability they can bring, but instead, how can they be used for the well-being of people? So, for example, the accessibility of antivenoms, I think, is a human right. It's not a matter of economic profitability. It should be viewed as a human right. And people working in science, technology transfer, and so on, should view the problem from that, I would say, philosophical perspective. We need more science, technology, and knowledge to be used for the well-being of humankind in many different areas. And the area of neglected tropical diseases is a clear example of this area. Another thought that I have is that it is necessary to support and strengthen scientific and technological development in countries of the global south. Unfortunately, there is a very strong asymmetry in the development of knowledge, in the capacity of countries and societies to develop knowledge. And the capacity of a country to develop endogenous scientific and technological strength, I think, is extremely important at this point of history. And this example of Instituto Clodomiro Picado clearly shows how a small country facing many economic and difficulties was capable of creating an ecosystem of generation of scientific and technological knowledge with a philosophy of well-being, and how this knowledge has served the purpose of helping people not only in Costa Rica but in many other regions. So I think the need to foster and strengthen endogenous scientific and technological capacities to be used for the well-being of people or for solving urgent issues in countries of the global south is extremely important. I think the example of Instituto Clodomiro Picado on the area of snakebite envenoming in Costa Rica is a good example that this can be achieved. This is feasible to do with political will, with academic support, and with the commitment of people working in our place. I would like to stress that the goals of our institute have been achieved because many people have been committed to develop good science, good technology, good social extension and projection, and it is due to the effort of these people embedded in a political will of a country that believed that science and technology was important for this particular area that has made possible the achievement that our institute has made.
Besides this important message delivered by Jose Maria, based on our endogenous, to believe in our endogenous capacity at low and middle income countries to solve to find solutions to our problems. I actually, since I born at ICP, I have been kind of receiving this message mainly from Jose Maria. So one thing I think that is really, really important is because I actually believe in this in the same strategy and in the same philosophy, and it's really important to bring this approach for us in our generation to younger generations. So this is a really important issue that to have these spaces so that persons that are just graduating from the university and just getting into contact with our fields could have this information, because it's really important to maintain this model in this world where there's so many, they are giving so many importance to the part of profitability and all that competition. So it's really important to maintain this core for me. It's a really important message for newer generations. And as Jose Maria said as well, this is all this that we have been talking is we are just a representation of the work of a lot of persons at ICP and around the stakeholders. And we have a really interdisciplinary approach. We have a lot of different professionals from different areas working along in group at ICP to have a vial of antivenom. And also I would like to point out the importance of other in the fact that we are talking about R&D. There are now emerging a lot of R&D and new strategies of alternatives to antivenoms, like new inhibitors, new different products that could also be a solution for snake bite envenomation, and they represent for me a really big hope and a great of joy. But I would like to also um, try to give a really big message for these different groups working in R&D to become along and together with the local manufacturers that are the ones that are transforming the medicines into a vial, so we can strengthen the collaborations and the communication, because between these R&D new technologies and the actual concrete um, medicine production. And this will be a really good strategy to along together work together to get to these big new steps in antivenom therapies.
Excellent. Thank you so much for these teachings, for your words. And I'm looking at the time. I think that we are a little bit above. And I would like to wrap up the conversation. I want to thank you again for all your insights, for telling us a bit about your background, about the structure of the Institute, the organizational form, the very complex partnerships model that you're adopting, and for sharing more about your strategy with regards to intellectual property and with global access. So again, I think we're going to wrap up the discussion. I want to thank everyone who's joined and listened to this conversation, for listening to the end. I hope that it was as insightful for you as it was for us. And last but not least, I'd like to thank Professor Jose Maria Gutierrez and Dr. Maria Angela Vargas for joining us, for giving us their precious time and explaining a bit more about how the Clodomiro Picado Institute works, and the intricacies of this alternative approach to global health R&D. This was an interview series from the Community of Practice for Global Health R&D, an initiative hosted by the Global Health Center within the Geneva Graduate Institute and co-convened in partnership with United Efforts for Innovation, Access and Delivery. So I would like to say goodbye and thank you again for joining, and we hope to meet again soon.
Thanks for the invitation. It was a great pleasure.
Yes, thank you very much. It was a great pleasure to present our experience. We hope that will be useful for other groups, and we really look forward to also to hear experience from other groups and to learn from other stakeholders in this field. So thank you very much for the Community of Practice for Global Health R&D and the Global Health Center, and we hope to be in contact in the future.
Wonderful. Thank you so much. Okay, goodbye.
Bye bye. Take care. Thank you very much for the invitation.
Thank you.